Hello, folks. Thanks for coming. We have a very, very special guest today. I'm interested in you getting to meet my friend, uh, Dr. Dennis Garvin, who is a medical doctor. We've had lots and lots of conversations since the coronavirus has hit us last year. So we're going to get a short interview with Dennis so that you can kind of understand where he's coming from. So Dr. Garvin, thank you very much for coming. The first thing I'd like you to do is give me a better understanding of who Dr. Dennis Garvin is, and a little bit of your background and how you came to the point where you're going to be my expert on the coronavirus.
Well, briefly, thank you. I grew up in a medical family with my mother a nurse. Most of my aunts were nurses. I had an uncle who was a doctor. My brother went into medicine. I went into medicine. I went to medical school after graduating from a military college. I then entered the Air Force on active duty at my medical school. After that, I did 5 years of surgical training, served active duty again for a period of time, then went out in private practice. Throughout my practice, I have adhered to what I think most physicians adhere to, and that is prevention is better than treatment. And we should try to emphasize any preventative measures that we can, such as the stopping of smoking or the control of diet for diabetics, a variety of general health matters that are across the board beneficial. But as a physician and as a surgeon, I also was involved in the treatment of those people who became ill despite preventive measures. And I am, as our subject would suggest, becoming increasingly concerned about the way medicine now has seemingly changed so completely in the face of this pandemic.
All right, now, Dr. Garvin, you are still a practicing doctor, is that correct?
That is correct.
Okay, and my understanding is you've kind of been traveling around the country, so you've seen a couple different areas around the country. So we might in later conversations talk a little bit about what you've seen at different locations. But what is your general philosophy about this? You're talking about prevention and treatment. Since the coronavirus came upon us in January, just about a year ago, last year, how have you seen the philosophy that you had while you were training and also as an acting physician? How have you seen that change for the good or for the better in relation to the coronavirus?
Well, as far as the prevention side of medicine, I will say that American medicine as a whole has moved generally towards a greater emphasis on prevention and maintenance of health. As regards the virus, I am concerned because prevention, quite simply, right now it involves masks, social distancing, lockdowns, and vaccines. It should also involve the correction of those comorbidities that we know will predispose an individual to a greater risk of not just COVID, but of dying of COVID. What I'm seeing now is that while I have no problem with social distancing and masks, it has become holy writ, and there has been no proper studies done on that. There are retrospective studies, but there are as many that say there is no benefit as there are that show that there is. As far as the comorbidities are concerned, they are curiously being ignored, and the main one being obesity. The risk factors for COVID complications are age, which we can't correct, obesity, which we can correct, control of the diseases that the person has, such as diabetes, hypertension, heart disease, COPD, and kidney disease. Mm-hmm. I find it curiously absent that the authorities are not emphasizing the need, for example, for weight loss. As far as the vaccines are concerned, I am a proponent of vaccines, but I do have concerns with the way that it is being dealt with on a scientific and on a propagandist basis. And then for those people who either cannot take the vaccine, cannot engage in preventive medicines, or do all of that and still become ill with COVID, we have to have treatments. And that has been not only shockingly absent, but has been attacked by the so-called medical authorities, CDC, NIH. It is astonishing the vitriol with which they attack those people who are trying to come up with treatment plans.
Right. Let me stop you there. So I think that's okay. So I guess the overarching question that I have is, because we're getting a lot of this information directly from the CDC and also our government officials, both the Virginia Department of Health, because you and I are in Virginia, but every state has their own Department of Health. A lot of this information is coming from the CDC, and I guess originally from the World Health Organization, through our political leaders. Okay, and I guess the question is, why do you think they're emphasizing certain things, and like you said, in the suggestion of treatments or using existing drugs to help us in the fight with the coronavirus? Why do you think they're all speaking the same thing? I mean, like I said, it's the CDC and the health organization, plus a lot of political leaders. But there are people like yourself on the front lines that are saying something totally different. Why do you think there's that difference?
Well, I do believe that there is a political motivation here. And of course, I have to be very careful about defamation. But I think the first thing we need to understand is that the NIH and the CDC, these are not physicians. There are some physicians on the board, but they are not practicing physicians. Fauci, for example, NIH, is not a practicing physician. These people essentially initiate trials elsewhere and fund them, and they review literature from the United States and around the world, and then make recommendations based on that. What I am concerned about is the absence of attention being paid to the world's literature, and the absence of any funding coming out for anything as far as treatment for those people who get sick despite the vaccine or who can't take the vaccine. Not only is there no research being done, but those alternatives that are being created out in the community are being savaged. They're being poo-pooed, and of course the press is going right along with it. Right. I don't understand the motivation, but all you have to do is look at some of the facts and they may speak for themselves.
Okay, now we did have, I'm thinking of two examples where we had treatments. We had remdesivir, which was fairly early, I guess maybe in the early summer, that came on the radar. And then we had the treatments that Trump had when he got coronavirus in the fall, the mononuclear, where they were reproducing the antibodies in his body. Those two don't seem to be being used very much. I mean, either they're too expensive or they're not available or whatever. And then we're hearing on the other side, we're hearing, hydroxychloroquine, we're hearing some other drugs, which I'm sure you're going to talk about. So there is some activity in treatment, but your complaint is the fact that there's not enough, or they're not using existing drugs for the coronavirus that might be effective.
Yeah, there are multiple yeses to what you just suggested. The first thing I think we want to deal with is what we call off-label prescribing or alternate use of existing medications. And we're talking about, yes, I'm sorry, you said Rationale. Is that the one that you said?
Right.
To get that. Yeah, that comes from a family of the antivirals that have been used in HIV. And we've also got budesonide, we have the hydroxychloroquine, and we have ivermectin. These are medicines that have been around for a long period of time and have been used successfully elsewhere. Their off-label use or using them for an alternate purpose has invariably come from the physicians that are clinicians, not the CDC, not the NIH. These are guys giving these patients a medication and found there was an alternate use. For example, hydroxychloroquine was originally a malaria drug. When giving it, some of these doctors realized that their patients with lupus or with psoriasis got better. And so they began using it. And now Plaquenil, hydroxychloroquine, is now being primarily used because it helps psoriasis and lupus. And that was found by the guys in the trenches. Aspirin was given for arthritis. When we saw it thin the blood, now it's almost never given for arthritis because the trench doctors found that it thinned the blood and helped to prevent heart attacks and strokes. So a great many of our current medications are medicines that have been found to work better in an alternate setting. And the same thing has occurred now with Plaquenil, with hydroxychloroquine. It has been shown by trench doctors to work, the guys out on the front lines. Same thing with budesonide, and the same thing with ivermectin, which is basically an antimicrobial. It's derived from streptococcus, and it's been used for years around the world for a variety of parasitic, viral, and bacterial illnesses. And there are studies outside of the United States that have shown them to be effective. The response to me is astonishing because Fauci essentially poo-pooed when Trump talked about Plaquenil. When budesonide was found to work, it was found by a Texas physician, and so they hired Matthew McConaughey, curiously enough, a Texas actor, for an infomercial in which they poo-pooed it. And Fauci even had the incredible arrogance to say that any benefit would have been placebo. If you are having trouble breathing and you take a medicine and you start breathing well, that is not placebo. Same thing with ivermectin. There's an Argentinian study that is astonishingly effective, and yet none of these medicines are being given. It's very hard to get them. I myself have tried to prescribe them for family members or other people, and there's difficulty with it. They've jacked the prices up. They've made it hard to get, and these are medicines that have been around for over 50 years. So
yeah,
I am worried about that.
Yeah, and I understood that when hydrochloroquine came out and they were talking about it, and Trump made a couple statements about it, that he said that there were millions and millions and millions of doses, that it was just something that was in the market and it was readily available and it was cheap and we should at least try it. Is that still not? Is that not the case? Is that particular drug hard to get a hold of?
No, it's not hard to get a hold of. It's been around for years. It's been generic for years, and it is currently given for people with lupus and psoriasis. And it has been very healthy, very safe. But now you're beginning to see people in the literature complaining about the effect of Plaquenil on the EKG, on prolongation of what's called CT interval. Then it was said that when it was being given for psoriasis or for lupus. The other problem that I have,
So can I stop you there? Let me stop you there. Sorry to interrupt, but that's really, really interesting to me. So when hydrochloroquine came out, you're calling it something different. Are we talking about the same drug?
It's the same drug. Sorry, yeah.
Okay. So then they started talking about this fact that it was a contraindication if you had heart issues, right? But you're saying that was never a concern when it was being given to people who were either had malaria or the off-use components of psoriasis. You're saying that it was never really an issue. You weren't less likely to give it to somebody because of their heart condition.
No, it was that basically they are now emphasizing that as a risk factor, where before it was something that the physician knew about
Right.
and would talk with the patient about, and if they had a normal EKG and you gave them the medicine, you could recheck an EKG, and if it didn't prolong that interval, that patient did not have that one, what we call idiosyncratic reaction to the
Right.
medication.
Okay. And your belief that they started to highlight that was to suppress the use of that particular drug in the public? Is that
Yeah, increase the fear factor. Now they can say, "Oh no, we're just trying to educate the public." Well, they're educating them with fear. It's propaganda.
right?
So,
Right. Okay. All
okay.
right. All right. So
The other thing I would say,
so that makes a lot of sense to me. So continue on with I think what you're saying, I love your term, the trench doctors. I think that's great. That's very descriptive. So is this an information gap that Dr. Fauci and the NIH and CDC and the coronavirus task force just has all this ability to communicate to the public, and the trench doctors do not? Is it as simple as that? That if we
yes.
elevated more of the trench doctor's philosophy, maybe we would have a better understanding of the possible treatments for the coronavirus? Is it that simple, or is there something more behind the difference?
Well, the problem is that the press, I believe, has been complicit. And we mentioned this, that there was a Senate hearing in early December chaired by Senator Johnson from Arkansas, where he met with several physicians regarding the antibiotic ivermectin. And they were talking about efficacy. Before, the minority was represented by Senator Peters from Wisconsin, who got up before the doctors spoke and savaged them, accused them of being politically motivated, and then he got up and left and didn't even listen to them.
Oh,
There
wow.
were several, but the one that I believe was the most, he was the most appealing because he was almost weeping, was Victor Corey, K-O-R-Y, or maybe K-H-O-R-Y. So
Okay.
if you were to go on to this Senate hearing, ivermectin, Senator Johnson, and then listen to Johnson, listen to Peters, and then listen to Corey, because it was not political. They were in favor of the vaccine. They were talking about, please do the vaccine, but let's begin to come up with alternatives to treat the people who get sick anyway. And they were savaged. And the curious thing about it is that Corey is a lifelong committed Democrat, and a Democrat senator basically savaged him because they thought he had wandered off the reservation.
Right.
The other concern that I have, as we talked about earlier, is that the problem, first of all, with the vaccine, we already know that it is mutating rapidly. Japan, the UK, and South Africa have already reported a rapidly changing, mutating strain.
Right.
And Fauci himself, back in the 1980s, was the poster child for the treatment of HIV. And one of his statements was the difficulty with coming up with a vaccine was because the virus was mutating so rapidly. Viruses mutate. That's why you've got to get a flu shot every year, because last year's shot won't work this year. This virus is mutating very rapidly, and that means that you're going to have to get a shot with each mutation. Oh no, they're saying, the experts, that they believe that the current vaccine will help. They have no proof. They would have to start again and take our vaccine and take it over to South Africa, take it to England, take it to Japan, and demonstrate that it works against this strain.
Right.
Nobody would say that last year's flu shot or the flu shot from 2017 would help in 2020. Nobody would be that foolish. But they're still pushing the vaccine despite its rapid mutation rate, which Fauci himself in 1980 said was a problem. The other problem with Fauci was that he fast-tracked two medicines, repurposing the medicines, azathioprine and Imuran. Okay. And he was on board. He fast tracked this without research. And the complaint that he came up against was there are no proper clinical trials for the effectiveness of these medicines. He overrode those and he got that done. And now he's on the opposite side because when Plaquenil was being utilized, when Trump mentioned it should be utilized, Fauci said there have been no proper clinical studies. So he flipped his argument. Why could that be? Well, the Fauci in 1980 is not the Fauci that in 2012 was named to the Gates Foundation Senior Advisory Council, and they're the ones that are putting out the Moderna vaccine. I'm not saying that he has a conflict of interest, but to me, for a doctor or any healthcare official to say we only have prevention, we're not going to work on any treatments. And now, of course, the antivirals, the HIV medications, those are being utilized. But these others, basically, and if you look at Dr. Corey on that interview, that Senate interview, he has been taking care of these people. He is an ICU specialist, a pulmonologist, and he is watching people die. And that's tragic.
Okay, this is what we'll do, Dr. Garvin. We'll make sure that those are in the description for this show, so that people can go to that video and look at both the Democratic congressman and then also Dr. Corey's statement when he reads it. So we'll make sure that that's in there for our readers. I want to come back to something that you said though. So let's go back to HIV. So HIV, there was never a vaccine that was developed. Did they try to develop a vaccine for HIV, or did they just say
they tried?
We're not gonna go that route. We're gonna put all of our efforts into treatment.
That's something that's still under investigation. They are still talking about coming up with one, but it is very interesting to me that after all of this time, the reason that they have failed to come up with a vaccine is because of the mutation rate that is similar to what we're seeing in the coronavirus.
Right. And the treatment has been pretty effective, right? The treatment has been fairly effective for HIV.
Right. And people are no longer looking upon it as a death sentence.
Right. So let me take that, because I don't want to get too deep in the HIV and Dr. Fauci being involved in that decision. I want to come back to treatment of the COVID of the coronavirus. Okay. So you said something very, very interesting, which I take personally because I'm obese. So it would have been nice for somebody to say, let's use this as an opportunity to get the health of the nation back and to get people eating better, and then also understanding our immune system and how our immune system could take care of this virus, because this is not going to be the last virus we're going to have to deal with. Our bodies are dealing with bacteria and viruses all the time. So you had said something to me in a private conversation that I want you to finish up the last little bit of time. We've got about 6 or 7 minutes. And this is on treatment of the coronavirus, okay? And then with our next segment, which will probably be longer, we're going to talk more about treatment, and then also what we believe is the information that's being given to us that might not be the best information for our health, okay? And you had mentioned to me the way the virus gets into your body, okay, going through your nose and your mouth, and some of the things that we can do before we even start getting sick in a preventative way. Okay, could you share a little bit of that with us with our remaining time about how our viewers can help themselves today, rather than just the mask and the social distancing? And we can talk about that next time. But some of the ways that they can take care of themselves with any kind of bacteria or virus.
Okay. First, I will say that what I'm about to recommend, Dale, we should probably put this into the information at the end, because there is a website called budesonideworks.org. distill.com. And
Okay.
this was by the doctor in Texas, the emergency room physician, who came up with the idea. But these are things that both my wife and I do on a regular basis. And that is, the virus gets into your mouth and into your nose, and that's where it replicates first. And that's why these people end up generally having a severe sore throat, because that's where the virus goes. But it doesn't go into the bloodstream and go to the lung. When you inhale, if you were to cough and you had COVID and I inhale it, the virus that gets into my lungs is not going to be what causes trouble. It's going to be the fact that I'm inhaling the viral load that I've developed in my mouth.
Right.
So the best way is, if you've been out in public, is to protect other people. You get up in the morning and you swish and deep gargle with one of the mouthwashes that is labeled 99.9%. Like,
Okay.
I guess we're okay with using commercial names, Listerine, Press.
Right.
It says that you are going to be destroying the viral load that got into your mouth, and that's going to help you. And then certainly, if you've been out in public, you should do it at night, because it, and waiting, until the next morning is probably still okay, because it is a slow growing virus. As far as the nose is concerned, there's budesonide spray. The brand name is Rhinocort, Rhinocort, and that's 2 squirts in each nostril, along with the mouthwash in the morning and at night. That is a steroid, and that apparently blocks the response. And that is part of the problem with how coronavirus is so vastly different from HIV. HIV attacks and compromises the immune system. Coronavirus actually harnesses the immune system. And it's when it gets into the nose, into the mouth, and then into the lungs, it excites, and this is with the CDC, you can go there and it will explain it. I'm not just making this up. It is fearful that it excites a cytokine release that essentially is like the immune system screaming to itself, the sky is falling, and then it essentially attacks the virus in the lung, but it's like burning down the house to get rid of the mice. It essentially damages the lungs. So you're getting an immune damage. That's why these medicines work with psoriasis and lupus, because these are autoimmune, where the immune system is attacking the host. So these are all steps that people can take, along with zinc. Okay, unfortunately, you have to get about 50 milligrams. It's not just the recommended daily amount, which is somewhere around 11 to 14. And aspirin, baby aspirin is fine if you can take it. But those, to me, are proactive measures. The nose spray, the mouthwash, the zinc, and the aspirin are things that I think everyone can do. And then, of course, weight loss and better control of your diabetes, of your hypertension. People that have got hypertension and heart issues, if they don't have a blood pressure monitor at home, please go get one and make sure your medicine is working.
Right.
These are just common sense things to make yourself a less attractive target to the virus.
Right. Boy, what great advice. Wouldn't it have been nice if the coronavirus task force had said that first? And we can talk in future conversations about the efficacy of masks and social distancing. They all kind of make sense to me. I understand why sometimes people are asking you to do these things, that there's some control aspect to this. But wouldn't it have been nice for all of us to hear your common sense conversation about the things that we can do to make ourselves healthier, so that, because we're going to deal with this virus and other viruses in our lifetime. This is not the last one. It wasn't the first one. And we're going to do this probably every year, a couple of years. We're going to come in with something. And if we're in a much better state, health state, we'd be a lot easier to fight these things off. So thank you, Dr. Garvin, for all that great information. I have more questions than you can possibly answer. So the next time that we meet, it'll probably be longer. We'll talk about masks and the efficacy and the whole social distancing, which led us to locking down a lot of places. You know, it's okay for us to go into a Lowe's, but it's not okay for us to go to church. That's going to be a real interesting one for us. So thank you very much for all that great information. And if you could say one thing to your viewers to kind of end this and set us up for the next show, what other advice would you give us?
Well, I would say this, Dale, that my primary focus is, having dealt as a surgeon and as a physician with cancers, with people with recurrent, extremely difficult medical problems. Something my patients have taught me is, what you don't want to do, you want to empower them. They want to be part of the solution. And common sense tells you that these people want to do something. It's a battle, they're being invaded. And the things that you are bringing out of me, thank you, with the discussion, it has been the sum total of my desire so that the patients go away from my office feeling like, I can do this. I've got marching orders, I've got my ammunition, I've got my bullets, I got my gun, and I'm going to kick some viral butt.
Yep.
And that's what we should be doing instead of this constant fear mongering.
Right. God bless you for that, because that's, you know, if we can get people to feel, like you said, empowered and positive, and I can do this, my body's strong enough to be able to do that. I think that helps a lot of us with our ailments. The fear is just, it's depressing. It's kind of, you know, you can't solve this. We'll be around with a vaccine in a year or so. So just hang on. I hate that. I hate the attitude that we're getting on a daily basis with this information that's just beating us down and making us fearful about something that we should be able to use good knowledge that you're bringing us and do some things for ourselves to protect ourselves and our families. So thank you so much for that uplifting message, and we'll see you next time. And like I said, I'm gonna have lots of questions for you next time, so thank you very much.
I look forward to it, Dale. Thank you.
All right, thank you, Dr. Garvin. Have a great day.
Bye-bye.